Hello. Hi, come. Rupa, right?
Yeah.
I'm seeing your thing only. Yes. Yeah, thanks. Should I sign you? Yeah. Smile. Yes. Okay. Now, with regards to the chin, we can definitely make it a little bit more pointy, a little bit more proportional. We can advance it. Vertical height, we don't have to increase for you. It's quite proportional. Horizontally, we can bring it like this, but not like this. Okay, that's with the chin. Now with the nose, you have to tell me what you're expecting, because I can make it very much prominent or little prominent. What kind of expectation or what is your look? We can plan on that. I feel, it's not looking bad. The nose is quite fine. We can augment it if you want a little bit on top and narrow it a little bit, and that's all.
Just same thing. I don't want it.
That's it. Minor to few millimeters we can do.
About the chin, like only horizontal is fine.
Vertical, not much. Maybe 2-3 mm you can do. Very minimal. Just naam ke wase type things, not lots. It will not look good for you otherwise.
And now about my upper jaw.
But the chin is wide now. We will make it narrow.
Okay.
See the chin. Okay, it's pretty wide. We will make it almost half. So when you look on the side, it will be a nice pointy chin. Now it's broad. And then this angle is like this. So this angle will be coming like this and going. So it will be pointy and coming up, both. Without increasing vertical height too much. I don't think it will look good if you do too much vertical for you. Because your forehead is also that much only, nose also that much. Then if you give this more, it will not match for you. And you are also short. No, I'm not saying in the bad way it's short. I'm saying just that it should match with.
It's a fact. About my upper jaw, is it fine?
Yeah, nothing you should do.
Like one of my doctors told me that it's like
No.
I have to get bi-jaw surgery.
No, don't do that. See, then what will happen? Your lip will have loose support, it will become like old and all. When you do this, it will balance. See, this looks like this too is forward, so they want to take it inside. But what we are doing, we're bringing this forward and nose forward.
Yeah.
It will match. That will look better, younger, fitter, rather than taking it in.
Okay.
Don't do that.
And my mouth opens automatically, like when I'm sitting. That will also be.
That will remain the same. Your mouth is opening automatically because
of my teeth.
probably also a little bit of your habit. That won't change.
So there's no way we can correct that.
Then if I have to correct the thing, I'll do upper jaw surgery. It will not look good for you aesthetically.
Okay.
Don't think you need to do that. Because it looks correct on the scan. It's just very minimal. See, when it's a borderline excess protrusion of the upper jaw, you don't take it in. You try to do something to bring the thing out so that the skin stretches and you look younger and fitter rather than taking it in. We take it in, of course. For some person, there's no other option. When there's a clear indication of an overgrowth of either of the jaws, either in the vertical or horizontal component, we must take it in. But here it's not the case. Then why would you do it? You won't need it. See, once the balance improves, you will not even feel like there's something happening there.
Okay.
And after rhinoplasty, you can't wear specs for a few weeks. Huh?
And
How bad is your this thing?
it's 3.75.
You have lens?
No.
Better to get lens.
Actually, they said like for my power, it's not good to get lens. Like some cylindrical power is high, so.
But this is only temporary, right? I'm not asking you to use lens for months.
Okay, so how many days?
2 weeks, 3 weeks, you can use lens.
Okay.
If there's a eye hospital here or anywhere, you can go tell them that say I want lens just for a few. They'll give you.
Yeah, sure.
Better to use. I recommend that because this will Because we're doing augmentation on the nose, we're working on the bone, and keep wearing it will depress them.
And it will be the rib harvesting, right? Not
Yes.
the lens, right?
No foreign material. Rib only.
Over age, like bone will grow, right? Like face shape will change.
No, for
So-
chin it will just settle down. It's not. It won't take over years. Over a few weeks, it will heal.
No. I'm asking like for a normal person over years, like face will grow wider and like.
That's if you put on a lot of weight. The body also will grow wider. You cannot grow taller, unfortunately. So we can only grow wider. Correct.
So it won't affect this one, right? Like if I get it done.
Well, if you grow wider, it will become chubbier your face. That's all. This chin is going to be the way it is. The proportions will change. See, now you have a good proportion face, height to weight. If you put on 20 kilos more, well, there will be fat everywhere and you may not look the same you're looking now. But that's not because of what we've done. That's because you put on weight.
No. I'm asking like if I put on weight, how this like how
This will be the
This
same.
will be the same.
But the face will change still.
That.
Yeah.
Anyway, it's not.
You planning to put on weight?
No.
Yeah, good. Don't plan.
I'm doing this.
That's not a good plan. We are actually fighting not to put on weight. If you plan to put on weight, the easiest thing on life, on earth. But after you can put
It's
on weight.
not. It's
Really?
easiest. It's not.
It's difficult for you to put on weight. You're a very blessed person. Yeah, I'm not joking.
Like I'm just underweight and I have to put on weight, but not that much, like 20.
We are not underweight enough. What is your weight
40.
now? 40.
I came from 37 to
40 should be fine for your height. It's that you should check the BMI, the height to weight ratio and everything. Yeah. But it's good if you find it difficult to put on weight. In some years it will change. Because, that's what I think.
Thank you.
Bye.
Bye.
So let them know when you want
Yeah.
the procedure also. You've come alone or you have someone with you?
I've come alone.
Okay, so you have, how long you're going to stay with us?
1 week. Like I watched the video.
More than that. No, more. 1 week is like bare minimum. We'll do 2 procedures, right? 10 days.
Okay. I have to bring someone with me, right?
No need. You can be alone. But you should try to be with us for 7 to 10 days.
I can be alone.
Yeah, that is not a problem. Alone is not an issue, they'll take it. But the duration should be adequate. Okay? Because otherwise, if you go off any issues, then you find
So if I'm okay now, like in how many days?
that you ask outside, they might be able to give you an appointment as soon as possible. Tomorrow or next week or next month, I don't know. Just check with them, they might have appointments. That you talk to them and then they will schedule you. Okay? Bye.
Thank you so much.